Hello, everyone. I will be talking about a neurologic disease called Meralgia Paresthetica. Meralgia Paresthetica, also known as Bernhardt-Roth syndrome, is a medical condition that results in tingling, numbness, and burning pain in the outer thigh. The condition is caused by the compression of the lateral femoral cutaneous nerve, which supplies sensation starting from the inguinal ligament and extending down to the knee. While the condition can be a bit bothersome, it is not life-threatening or dangerous to one's health. In our bodies, the lateral femoral cutaneous nerve passes through the groin to the upper thigh. But in Meralgia Paresthetica, the nerve becomes trapped under the inguinal ligament, which runs along the groin from the abdomen to the upper thigh. A variety of factors can compress the lateral femoral cutaneous nerve and can include injury or surgery in your hip area, tight clothing, such as belts, corsets, and tight pants, medical conditions like obesity, pregnancy, and diabetes, a tumor near the LFCN, and fluid accumulation in the abdomen. In Meralgia Paresthetica, the lateral femoral cutaneous nerve impacts sensation and does not affect leg muscle function. A surgery in the hip area, pregnancy, and pressure on the LFCN are mechanical or iatrogenic conditions that may affect the compression of the LFCN, while diabetes and obesity can lead to metabolic injury or neuropathy of the LFCN. However, the cause may also be idiopathic in obese or pregnant patients, in patients aged 30 to 50 years old, and in patients with carpal tunnel syndrome. These factors compress the lateral femoral cutaneous nerve, leading to Meralgia Paresthetica. Meralgia Paresthetica can cause the following symptoms in the outer thigh: burning pain, decreased sensation, increased sensitivity and pain in response to a light touch, tingling, and numbness. These symptoms typically occur on one side of the body and may worsen after walking or standing. The following factors may increase the likelihood of Meralgia Paresthetica: extra weight. Being overweight or obese might put more pressure on the lateral femoral cutaneous nerve. Pregnancy. A growing belly puts added pressure on the groin, which the lateral femoral cutaneous nerve passes through. Diabetes. Diabetic nerve damage might result in Meralgia Paresthetica. Age. People between the ages of 30 and 60 are at a higher risk of developing Meralgia Paresthetica. A doctor typically diagnoses Meralgia Paresthetica based on your medical history and physical exam. The doctor may ask you to test the sensation of the affected thigh, describe the pain, and trace the numb or painful spot on your thigh. Additional testing, such as strength and reflex tests, may be performed to rule out other possible explanations of the symptoms. Your doctor may also order the following tests to rule out other problems, such as a nerve root problem or femoral neuropathy. Imaging studies. Although no specific alterations are seen on X-rays if you have Meralgia Paresthetica, photos of your hip and pelvic area may be useful in ruling out alternative causes of your symptoms. If your doctor feels that a tumor is causing your pain, he or she may conduct a CT scan or an MRI. Electromyography. This test examines the electrical discharges produced by muscles to aid in the evaluation and diagnosis of muscle and nerve problems. To record electrical activity, a tiny needle electrode is inserted into the muscle. The results of this test are normal in Meralgia Paresthetica. Nerve conduction study. In a nerve conduction study, patch-style electrodes are applied to your skin to deliver a moderate electrical impulse to the nerve. The electrical impulse aids in the diagnosis of damaged nerves. Nerve blockade. A nerve blockade is an anesthetic injection into your thigh that confirms whether or not you have Meralgia Paresthetica. To guide the needle, ultrasound imaging may be used. For most people, the symptoms of Meralgia Paresthetica subside within a few months. The goal of the treatment is to relieve nerve compression. Some conservative measures include wearing looser clothing, losing excess weight, and taking acetaminophen such as Tylenol, ibuprofen such as Advil and Motrin IB, or aspirin as an over-the-counter pain reliever. If symptoms last longer than 2 months or if the pain is severe, treatment may include corticosteroid injections. Injections can reduce inflammation and provide temporary pain relief. The possible side effects of corticosteroid injections include joint infection, nerve damage, discomfort, and whitening of the skin around the injection site. Gabapentin, phenytoin, or pregabalin. These anti-seizure medications may help lessen the painful symptoms of Meralgia Paresthetica. Some side effects of the anti-seizure drugs include constipation, nausea, dizziness, drowsiness, and lightheadedness. Radiofrequency nerve ablation. This treatment creates a current by using radio waves to heat a tiny region of nerve tissue. The heat destroys that part of the nerve, preventing it from sending pain signals to the brain. Tricyclic antidepressants. These drugs may help you feel better. However, the side effects of tricyclic antidepressants include drowsiness, dry mouth, constipation, and reduced sexual function. Physical therapy. Physical therapy strengthens the muscles of the legs and buttocks, and reduces injury to the hips. Surgery to decompress the nerve is rarely considered and is only available to people who have severe and long-lasting symptoms. The following precautions can help lower the risk of developing meralgia paresthetica. Avoiding the use of girdles or belts, especially tool belts. Maintaining a healthy weight or losing weight if one is overweight. Wearing loose-fitted clothing. And performing muscle stretching and strengthening exercises. And that's the end of our video on meralgia paresthetica. Don't forget to like this video and subscribe for more videos. Thank you for watching.